Alert! 7 common medications that cause serious dementia. Today, we will embark on an exciting and eye-opening journey. Did you know that the pills you take every day to feel better might harbor hidden threats to your brain health? In this video, we will explore 7 common medications that research shows can increase the risk of serious memory loss. Get ready, because this information may make you rethink what you put into your body. Let's find out what these medications are and how they affect your brain. Before we begin, let me introduce a bit about Science for Real. This is where we provide you with reliable scientific information, helping you gain a better understanding of the world around you and what impacts your health. From the latest studies to intriguing secrets, we are here for you to explore. 1. Introduction to the link between medications and the risk of dementia. Have you ever wondered what is really in the pills you take every day? Most of us tend to trust that the medications prescribed by doctors are safe. However, there may be some surprises. Some common medications that many people use could potentially increase the risk of dementia. Increasing research indicates that certain widely used medications may be linked to cognitive decline. This is not just speculation, there is substantial scientific evidence supporting this connection. We are not talking about obscure drugs, but rather those that millions of people take to treat common conditions like allergies, depression, or heartburn. The awareness that everyday medications could negatively impact brain health causes concern for many. It contradicts the belief that approved medications are always safe. The human body is complex, and even helpful medications can have unintended side effects, especially with long-term use. Today, we will explore an intriguing topic: 7 common medications that may lead to serious dementia. 2. Anticholinergics. The greatest risk among the medications that can have negative effects on brain health, anticholinergics stand out as one of the main culprits. These drugs work by blocking acetylcholine, a neurotransmitter that is crucial for memory and learning. They are commonly used to treat issues such as overactive bladder, Parkinson's disease, and allergies. Numerous studies have shown that regular use of anticholinergics can significantly increase the risk of developing dementia. One study found that if you use these medications daily for 3 years, the risk of dementia may increase by up to 50%. This is a concerning figure for those who consider these drugs to be safe and harmless. Therefore, it is essential to be aware of these risks. If you or a loved one is using anticholinergics, consider discussing alternative options or other treatment methods with your doctor that may be safer for brain health. 3. Proton pump inhibitors, PPIs. And the link to dementia. Proton pump inhibitors, commonly known as PPIs, are a group of medications frequently used to treat heartburn and other stomach issues. These drugs work by reducing acid production in the stomach, helping to alleviate uncomfortable symptoms. However, the connection between PPIs and the risk of dementia is becoming a growing concern. Although the exact mechanism is not yet fully understood, numerous studies have indicated that regular users of PPIs have a higher risk of developing dementia. One large study involving over 70,000 participants found that those who used PPIs had a risk of dementia that was up to 44% higher compared to non-users. A possible reason for this link could relate to vitamin B12 deficiency, as PPIs may impair the absorption of this vitamin. B12 deficiency has been shown to lead to cognitive issues. Additionally, PPIs may promote the production of beta-amyloid, a protein associated with the formation of plaques in the brains of Alzheimer's patients. Therefore, if you are taking PPIs, consider discussing with your doctor about monitoring and reassessing your need for this medication to ensure that your brain health is not adversely affected. 4. Benzodiazepines. Long-term effects on memory. Benzodiazepines, a popular class of anti-anxiety medications such as Valium and Xanax, can provide quick relief from anxiety and stress. However, long-term use of these drugs may have serious consequences for brain health, particularly concerning memory. Numerous studies have indicated that individuals who regularly use benzodiazepines have a higher risk of developing dementia. One study found that those who had used benzodiazepines for 36 months could face a 32% increased risk of Alzheimer's disease, while this risk could rise to 84% for those who used the medication for more than 6 months. Although the exact mechanism is not yet clearly understood, benzodiazepines are known to negatively affect memory and cognitive function even in the short term. Prolonged use may lead to permanent changes in the brain, diminishing the user's ability to remember and learn. Therefore, if you are using benzodiazepines, it is important to discuss alternative options with your doctor to mitigate the risks to your brain health. Remember, seeking safer alternatives for mental health can provide long-term benefits for both your mind and intellect. 5 Corticosteroids and their effects on brain structure. Corticosteroids, commonly known as steroid medications, are a powerful class of drugs used to treat various inflammatory conditions, including asthma, arthritis, and autoimmune diseases. Although they can be highly effective in managing symptoms, long-term use of corticosteroids may negatively impact brain structure. Research has shown that corticosteroids can induce changes in the volume and structure of both gray and white matter in the brain. A study from the Leiden University Medical Center found that prolonged corticosteroid use, exceeding 90 days, may increase the risk of dementia in both men and women, particularly in individuals aged 50 to 60. This risk may depend on dosage and duration, meaning that high doses over an extended period are more likely to lead to cognitive issues. While short-term therapies, such as corticosteroid use for acute asthma attacks, generally do not pose significant concerns, chronic or long-term use warrants careful consideration. If you are using corticosteroids, consult with your doctor about your treatment plan and consider alternative options that may have less negative impact on brain health. Being aware of these risks will help you make informed decisions for your overall well-being. 6 Antidepressants. Relationship with depression and dementia. Antidepressants, particularly tricyclic types, are commonly used to treat depression and anxiety. While these medications can improve mood and quality of life, there is a potential link between their use and an increased risk of dementia, which requires careful consideration. Some studies have indicated that antidepressants may alter neurotransmitter levels in the brain, potentially affecting cognitive function. Certain drugs, such as imipramine and amitriptyline, have been associated with a higher risk of dementia, especially among long-term users. It's essential to note that depression itself is a risk factor for dementia, so determining whether this link is due to the medication or the condition itself requires careful evaluation. Nonetheless, users should be cautious with prolonged antidepressant use, particularly if they are at an elevated risk for cognitive issues. If you are taking antidepressants, talk with your doctor about any concerns and consider regular monitoring of your mental and cognitive health. Choosing the most suitable and safe treatment is important not only for mental health but also for long-term brain health. 7 Antihistamines. Risks of older antihistamine drugs. Antihistamines, especially older types like diphenhydramine, Benadryl, have been widely used to treat allergy symptoms. While effective at relieving symptoms such as itching, sneezing, and runny nose, these drugs may pose risks to brain health, particularly with long-term use. Many studies suggest that classic antihistamines have anticholinergic effects, meaning they can block acetylcholine, a neurotransmitter essential for memory and learning. Frequent use of these medications may increase the risk of developing dementia. Occasional use of older antihistamines to treat allergy symptoms may not carry significant risks, but prolonged, continuous use can seriously impact cognitive function. In contrast, newer antihistamines like loratadine, Claritin, and cetirizine, Zyrtec, appear safer and do not have similar side effects. If you're using older antihistamines, consider discussing safer alternatives with your doctor to minimize potential brain health risks. Managing allergy symptoms wisely is not only key to physical health but also an important step in protecting cognitive health for the future. 8 Opioids. Linked to cognitive decline. Opioids, a class of drugs often prescribed for pain management, have become a significant concern in healthcare. While effective for pain relief, long-term opioid use can lead to negative impacts on cognition and brain health. Numerous studies indicate that opioid users are at a higher risk for cognitive decline and dementia. A recent study found that people using opioids for chronic pain management have a 15% higher risk of developing dementia than non-users. This risk is especially elevated for Alzheimer's disease and other undetermined types of dementia. The exact mechanism is not fully understood, but opioid use may reduce social interaction and mental activity, contributing to cognitive decline. Furthermore, frequent opioid use can lead to other health issues like depression, which can also impair brain function. If you or someone in your family is using opioids, it's essential to discuss alternative treatments with a doctor and explore ways to minimize risks to brain health. Careful consideration of medication use is necessary to protect cognitive health and maintain quality of life over the long term. 9 tips and recommendations for medication use. When it comes to medication use, especially those that may impact brain health, here are some key recommendations to help protect yourself. Use only when necessary. Avoid taking medications if they're not truly needed. Many people take medications to alleviate mild symptoms, but if you can manage your condition without them, that's often better for your overall health. Use the lowest effective dose. If medication is necessary, work with your doctor to find the lowest effective dose that still achieves therapeutic benefits. This can help minimize the risk of side effects. Explore alternative treatments. Many non-drug options can be beneficial, such as cognitive behavioral therapy for anxiety or depression, or natural remedies to manage allergy symptoms. Monitor side effects. If you're using high-risk medications, carefully monitor for any side effects and report any changes in health to your doctor. Regularly reassess medication needs. As we age, our bodies process medications differently. Regular check-ins with your doctor help ensure that your medications remain appropriate and safe over time. Be careful when discontinuing medications. If you plan to stop taking a medication, consult your doctor to develop a safe tapering plan. Some medications can cause serious side effects if discontinued abruptly. By following these recommendations, you can make informed, responsible decisions about medication use, helping to protect your brain health and overall quality of life in the long term. The information you've just explored might change how you view your own health. Here at Science for Real, our mission is to empower you with knowledge, enabling you to make informed and smart health decisions. Don't let your daily medications become silent threats to your memory and mental clarity. Always discuss safer alternatives with your doctor, and don't hesitate to ask questions about the medications you're using. If this video has helped you better understand the connection between medications and brain health, please give it a like, share, and subscribe to our channel to stay updated with more valuable insights. We're here to support you on your journey of discovering the wonders of science, bringing you fascinating secrets and practical knowledge. See you in the next video, where we'll continue exploring the incredible world around us.